pushes for a single-payer health system in California. What would that mean for you if it passes? And why it's important to get early detection to treat one of the deadliest cancers. All this on a special edition of CCN Crown City News. Your news, your neighborhood, seconds away.
Do you have a great business idea? The Pasadena Enterprise Zone can help. The Pasadena Enterprise Zone, open for business.
Hi, I'm Jesse Avila at the Convalescent Aid Society, a nonprofit organization established in 1923. We provide the free loan of durable medical equipment, of hospital beds, wheelchairs, walkers, canes, and many other items. Your donations and contributions are welcome and greatly appreciated. We are located at 3255 East Foothill Boulevard in Pasadena.
We're here to help you!
Please give us a call and check for availability at 626-793-1696.
Hi everyone, thank you for watching CCN Crown City News, your neighborhood. I'm Sehnita Joshua Mattison. We're continuing our special edition of CCN with live interviews featuring people you'll want to meet. We start with an issue that has been dividing the country for quite some time, with some saying the Patient Protection and Affordable Care Act, or Obamacare as some call it, creates death panels and rationing. Others say they want the government to get their hands off their Medicare. The health care law at times seems to increase the blood pressure of folks at both sides of the aisle. Even supporters of the health care bill mourned when the single-payer option was taken off of life support before it became law. But now nationalized health care supporters are trying to revive that effort with a new state bill that would create a single-payer system in California. Irma Strantz with the League of Women Voters, one of the organizations lending their support, that is, to this bill, joins us live to tell us more. Thanks for being here, Irma.
Thank you very much for this opportunity. We've just finished an interesting conference in Pasadena that talks about single payer in California, SB 810, talked about that,
yes,
and the Affordable Care Act, the federal bill.
Yes.
And we are very pleased with a lot of the things that have happened as a result of the Affordable Care Act, but there are still a lot of people who will not have health insurance coverage for a variety of reasons. Either they can't afford it, or they have not been in this country long enough, this kind of thing. So with single payer, SB 810 for California, it covers everybody. And you were going to ask me a question.
No. Continue. Yeah. Well, I just wanted to ask you, let's just go back to the federal reforms. Why is the healthcare system broken? Why do we need the reforms? Why do we need SB 810, that is?
Well, in this country, we have a system of private insurance, and a lot of the costs of health care have been going up and up and up, and so a lot of people have not been able to afford health care insurance. In this state of California, there are 7 million people out of a population of about 36 million that don't have health coverage whatsoever. So when they need health care, they have to go to the emergency room and hope that they'll be treated. Otherwise, they go without. So that's one of the issues that's happening nationally as well as California. What did you
think about when health care reform was passed? What did you think of that whole bill?
Well, we wanted to see a single-payer component in it.
Mm-hmm.
Right now, the situation is it is totally managed by the insurance companies and the pharmaceutical companies, which means that there's a certain amount of money, a large amount of money, that the taxpayer and the private person who's paying for health care pays to insurance management, about 20% of our dollars, instead of going to direct care. And with single-payer health care, that doesn't happen because there is only the government, just like Medicare, providing the service.
Okay. Well, now, back when the healthcare debate was going on in full strength, they were the death panels was, the big term out there, and they were saying, well, things like the single payer, it's going to be the government deciding, what services and treatments people can or can't have. And so they might just decide, we don't have money, with the budget cuts and things like that. We don't have money to, take care of this disease or that disease. What do you say to that?
I say to that, let's look at a country, our neighbor, that has a single-payer health care system. That's Canada. And you don't have death panels there, and there's nobody going to the chopping block because their treatments are too expensive.
But a lot of times people will come to the U.S. Maybe they can have a wider range of things that they can go to the doctor for. But if they really need advanced care, they're coming to the U.S. for that.
Not necessarily. Not necessarily. No, there's a lot of wonderful care being provided in major centers in Canada, and so there are.
But there are people all over the world that come specifically here for their treatment, right?
Yeah, very specialized cancer care or whatever, yes. Yeah.
And does the system we have right now kind of promote that, let doctors be able to, specialize and have those new technologies that they might not be able to have in other systems that have national health care?
Well, I think that the systems, the developments of the equipment in the countries that have national health care match ours perfectly. And in fact, Japan, for example, has a whole lot of MRI machines and whatever. So, and their health care is much less costly than ours. So we have good equipment. The other countries have good equipment, but I think that in terms of our medical teams, we've got excellent ones as well. So it's not the provider system, that the quality we're talking about. It's the funding so that people could be able to afford it. In other words, that health care is a human right.
Now, tell me, Governor Brown just announced, major cuts that he's trying to have, cuts and tax hikes, $8 billion worth, basically, and that includes cuts to health care. In a system where our budget is just failing and in tatters right now, how can we afford SB 810?
Well, SB 810 does involve using Medicare money and Medicaid money, which is California's Medi-Cal. That's part of the pot. But the other is that it is the insurance companies and the pharmaceutical companies are not part of the administration and funding package. They're paid a fair price for what they do, but it's not that they own part of the business, okay?
Mm-hmm. Well, you're talking about fair price. Let's talk about doctors. I was just reading an article in Newsweek not too long ago talking about how, doctors, just to keep up now, they have to take on so many more patients. It's leaving, the doctor-patient relationship, it's just in disrepair, basically, where a doctor hardly has enough time to see their patients. Is this going to just make it worse, where they just have to take more and more on because the fair price, what might seem fair on the other hand, might not take into account some of the doctor's costs that they then have to have come out of their own pocket?
Well, the way the funding would be with a single-payer plan is that each clinic and physician's office and hospital, whatever, would put together their budget into what it would cost to provide a quality care as mandated by the law, a comprehensive program, actually more comprehensive than the Affordable Care Act, because dental and vision as well as prescriptions are included. So they put together a budget, and it's a cost reimbursement system. So whatever it costs them to deliver that, that's what they're going to be reimbursed, without money going to the insurance companies to double-check this and, micromanage.
Well, will it then mean, though, that the government takes on that role and is the one doing the micromanaging?
Well, think of Medicare. That's the government. And for a lot of people across this country are very happy with Medicare.
Okay. Now, thinking of a state like California, and thinking of the uninsured, a lot of the uninsured are undocumented people. Will they be covered in SB 810?
Yes, they would, definitely.
Okay. And how do you think people would react on the other side to having people who, maybe are here, as they say, illegally, but then they have full access to health care and those benefits?
Well, if they're living here and they're working here, they, number one, are part of the community, and they're often their children are going to school. We want a healthy environment. We want everybody to be healthy. We don't want infections and whatever happening. So having a healthy population is the number one thing.
Now, would they get the same coverage as their neighbor next door that might have, might be documented, or citizens? They would get the same exact coverage?
Yes, they would.
Okay, full range.
Full range,
okay.
Exactly.
Do you think that would upset some people? Can you see that upsetting some people?
Well, it might, but I think if they also think about the fact that we have a lot of people in this country who are uninsured and that are not getting treatment for infectious diseases or whatever things that are happening, we want to get everybody into the safety net of health care.
What do you say to people who say that health care is an entitlement? And, when you look at, Europe right now with all of their entitlement programs, and, a place like, Greece, I know there was just a New York Times article today with Paul Krugman talking about, that Greece is basically, it's falling under. It's going to take, France and Spain down under with them because they're just not able to keep up with the entitlements. What do you say to people who look at health care as an entitlement?
Well, I think that goes, in terms of Europe, that goes back to the last century in Germany, because it was considered to be an important thing for every citizen to have access to health care. Mm-hmm. And certainly England, Great Britain is the same thing. And Japan and Taiwan. I mean, I can go down the list of countries that feel that health care is a right, a human right.
Mm-hmm.
Yeah.
But are they able to have systems that don't sink under that weight? Because obviously, healthcare costs for individual families, often leads to bankruptcies and financial burdens, which is very sad and unfortunate for a lot of the families who, it could be any one of us that could happen to.
Right.
But when you have a whole, the national system carrying on that burden, and if it fails, it's letting down a lot more people.
Well, it may well be that in some of these countries people will be contributing more to their policies than they have in the past, just to keep the ship afloat. Mm-hmm. But as soon as they stabilize, I'm sure it'll go back to health care is a human right.
Mm-hmm. Now, right now, the Supreme Court is looking at the Obamacare as the health care reforms for its constitutionality. If SB 810 passes, are we going to see more lawsuits and more money spent on finding out if it's constitutional or not?
Well, there are different kind of issues I think that the Supreme Court is considering right now, which is the mandate that everybody pay, right? With single payer, this is a payroll kind of thing, and everybody's benefiting. The state can do it. The Supreme Court isn't going to interfere. For example, Vermont has a single-payer plan, which they're working on. And so we would not see that same kind of problem as it is federally.
Are there pitfalls in the Vermont single-payer plan that maybe the California plan has addressed? How is the system working in Vermont?
They are in the process of gearing up to it right now, and they're doing sort of a marriage between the Federal Affordable Care Act and the single-payer plan they have there. So it's going to be interesting. We're watching them very closely. Yeah.
Okay. And what do you think is the timeline for something like that? I mean, what do you think of the likelihood of this passing?
Well, in order to we get this through the legislature, we have to have sign-offs from the federal government because we're using federal money as well. Okay, so it could be 2-3 years, but if we get everybody behind it and everybody in the same boat and enjoying, and without having money going off for administration and profits and all these kinds of things, but being devoted to health care, then we're okay.
Well, you just had a forum just this past weekend on Saturday, May, what was that, the 12th?
Yes.
So you had a forum then. Do you have more events that you're having, workshops telling people about this and giving information?
Oh, yes. We'll be having another big conference in July out at UCLA. And we have web addresses and things. So if people want to find out about it, just contact Healthcare for All California or the League of Women Voters, and we'll put them in touch.
Okay. Well, thank you so much for coming out, Irma, and answering some of those questions.
Thank you so much.
We hope to have you again.
Thank you.
Okay. Well, continuing our focus on healthcare, one woman's struggle with cancer and how she survived when Claudine Robinson goes on camera with us. You're watching CCN, Crown City News, your neighborhood.
The CCN Energy Saver is brought to you by Southern California Edison.
Dave, what are some other ways customers can save energy?
Well, I certainly want to make sure that they use energy efficiently and wisely. One of the things that we recommend doing is turning off equipment when they're not using it. That's probably the most easiest and most efficient way of reducing their energy costs. But purchasing equipment that has, again, I say the Energy Star rating on it. We want to make sure that they use thermostats that are programmable, because that helps customers reduce operating costs by having equipment come on at the desired setting as well as the desired times. Weatherization, plugging up gaps in your walls or door seals, making sure that you don't have any air leaks.
Well, thank you for that information, Dave. Hopefully customers find it helpful. This has been Luna Petty with your CCN Energy Saver.
The CCN Energy Saver is brought to you by Southern California Edison. Energy Saver is brought to you by Southern California Edison.
We see the pink ribbons for breast cancer and the graphic anti-smoking campaign for lung cancer everywhere, but many of us don't know about one of the deadliest cancers out there. Colon cancer is the second leading cause of cancer death among men and women combined, according to the Colon Cancer Alliance, or the CCA. The CCA predicts that more than 140,000 people in the U.S. will be diagnosed with colon cancer in 2012, and more than 50,000 will die from the disease. Claudine Robinson with the American Cancer Society joins us live with the second part of our cancer awareness segment to tell us about her struggle with cancer and the hope she'd like to offer those battling with disease. Claudine, it's nice to have you back. You were here with us last year for colon cancer awareness. What have you been going through this year since you've...
Well, this year I've been talking mostly about colon cancer and also about colonoscopy because it is my opinion and my experience that taking a colonoscopy will let you know if you have colon cancer.
Why is the awareness for this disease so important? Because, you know, I think it's one of those, we hear about the others. Why does this one not have as much awareness to it?
Well, I think that the awareness of colon cancer is that right now it is very preventable. And it is mostly preventable by having the test. And the tests, of course, are colonoscopy. So I tell my friends and people that I meet, you know, have you had a colonoscopy?
So you're out there. You're not letting them go. I mean, so did you have a colonoscopy, and is that how you found it?
Oh, yes, definitely. That was how I found out. And the interesting thing about it was that it was several years ago, 6 years ago actually, and strangely enough, I didn't know what a colonoscopy was, and I was told to take one. And so
Who
I
were
said,
you from your doctor, friends, or?
Actually, I am a volunteer for the Cancer Society.
Okay, so you were there just being a good citizen.
Right.
And then they told you, hey, you should do this too.
Yeah, and so I said, okay, because I've never had one before, and so I did. You know, they said, you know, at age 50, you should have had a colonoscopy. So I said, okay, and I went to my doctor, and he gave me a colonoscopy, and guess what? Not only did I learn I had cancer, but, you know, there are 4 stages of cancer. I was in stage 3.
Oh, boy.
Yeah. However, I am cancer-free today.
Wow, that is amazing. What did you have to go through to become cancer-free?
Well, I took the Cancer Society, you know, all of those tests and the treatments, you know, and so
they were kind of guiding you through all of this, you know, telling you, hey, first you need to get the exam, and
right.
You know, when you learn news like that, it kind of feels like, where do I go next? And you
very
had
true, yeah.
You had them right there.
Yeah, and I had some really nice doctors, and and I didn't have at that time the radiation. No, I had the other, tests, the ones that I'm talking about.
No,
the
I don't.
Chemotherapy.
Okay, you had the chemo.
So I had chemo.
So that was quite a process that you had to go through.
Yes. You know what? What's also maybe kind of funny, but while I was having cancer and going through chemo, my memory got really bad. And I talked to my cancer doctor, and you know what she said I had?
What'd she say?
Chemo brain.
So you're really a hero here. You're laughing through all of this struggle that you've gone through.
Yeah.
And you're really a hero for a lot of those people. I mean, they couldn't ask for a better spokesperson. Someone going out there saying, hey, I went through the same thing, so I know better. You need to go get those screenings done.
Oh, definitely, yes.
So our audience has no excuse. They need to go get that screening.
Yeah, definitely get the screening. And also, if there are members of your family that have cancer or have had cancer, then you should go and have the test for sure, because it is possible that you could have it. However, it does not always happen in families where, a person has cancer, like in my family. None of my kids, I have 3, none of them, then they've had the colonoscopies, and they don't have colon cancer.
Well, that's amazing to hear, but I do want to just say how much of a local hero you are.
Yeah.
So we expect to see you back here next year.
Oh, I would love to be. The thing that I'd like to mention, I think I did last year, was that colon cancer is one of the 3rd most common diseases among African American men and women.
So that's definitely the community.
It is, yes, and they have more access to colon cancer than any other race does.
Okay. Well, that's why we really appreciate you coming and doing this, telling your story, because that's really what connects to people. When they see you, they're going to see, you know what, that could be my mom, that could be me, that could be my grandma, and so your story is going to be very meaningful.
Yes,
and we thank you so much for coming out here.
I'm so glad for coming.
All right.
And you know what else? The colonoscopies and the treatments of cancer has been so that 91% of people with cancer are cured.
Well, there you go.
Yeah.
So thank you for that. Yeah. And I'm sorry to rush you off.
Not a problem.
But we're going to fill in our go on. But we appreciate you coming, and see you next year.
Okay. I'll be glad to come next year.
Okay.
And
Thank
I'll see you then.
All right. Take care.
All right.
You stay with us for now.
Okay.
We'll close up.
Okay.
While music may be able to provide healing for the soul, Jazzy Jam Pasadena helps the local community and provides beautiful jazz music. When Romaine Jones goes on camera with us next on CCN Crown City News, your neighborhood. We'll be right back.
Hi, I'm Lori Webster. I'm the owner of Webster's Fine Stationers.
Hi, I'm Scott Webster.
You need to come and check us out because we've got great gifts for everybody in the family.
We have Fine Stationers by Cranes and Company.
We have some beautiful greeting cards, things that are unique.
And myriad of other things, so please come by.
And our phone number is area code 626-797-1135, and we're located at 2450 North Lake Avenue, Suite B in Altadena. Our motto is, let's do something good today.
If your child is getting behind in school and needs help organizing, reading, writing, or studying, Klein's Classes can help. Audrey Klein has been teaching for more than 20 years. Her book, Skills for Student Success, can teach your child essential learning tools. Klein's Classes are affordable and conveniently available online. You can view the lessons and educational films anytime.
I've seen children jump 2 reading levels in 1 year. I've proven it over and over again.
Don't let another semester pass without getting your child some help. Visit kleinsclasses.com and get started today. Unleash your inner shark. Sharky Zartman's book, Shark Sense, reveals the 14 life-changing steps you can take today to start reaching your goals. Through her witty yet no-nonsense approach, Sharky Zartman unlocks the lessons we can all learn from sharks.
I use the shark as a symbol for your inner source of strength and power, the part of you that doesn't know the meaning of the word can't.
Stop settling for less and start living with confidence and purpose. Order Shark Sense today at sharksense.org and get in touch with your inner shark.
Charles, Nice, Dad.
You don't have to be perfect to be a perfect parent. There are thousands of siblings in foster care who'll take you just as you are.
There's stories out of there for music helping nursing homes, patients, and those with dementia remembering events they normally forget. Jazzy Jam Pasadena may bring healing to the soul with beautiful music, but it also helps kids in need. One of the Jazzy Jam artists, Romaine Jones, joins us live with more. Thanks for being here, Romaine.
Thank you for having me.
Well, tell us, what's your role with Jazzy Jams?
Well, Jazzy Jam, the cause of Jazzy Jam is to basically raise money for arts, economics. When I was growing up in school, I remember we had a place to go to sing and to groom our talent. So what she wanted to do, Jackie Snell Brown, it's her vision, okay. And what she wants to do is raise money to bring arts and that type of, you could say that type of strong push back to the community.
Oh, we surely need that. I mean,
yes.
We're talking about budget cuts, and of course the arts are always,
yes, ma'am.
You know, sometimes the easiest to cut, unfortunately, but they're so important. Mm-hmm. How did you get involved with Jazzy Jams? How did you hear about it and think, that's where I need to go work?
Well, I'm an artist
okay.
in Pasadena. I sing, and also I have a CD out. And they heard my music and wanted me to perform there at Jazzy Jam. John DeCure, at the company we have, SEP Productions, I also work with him, and he lets me know when people want me to come and perform and stuff. So that's how I heard about it. And plus, I'm also dedicated to the cause of what's going on.
Okay. Now, as a kid, did you have programs that you were involved with? How did you get involved with music?
Oh man, I've been singing my whole life. My whole family.
In the shower? Or?
Yeah, well, in the shower.
Started there.
And also in church, growing
okay.
up, and in nightclubs, stuff like that. My whole family is a family of singers, okay. And it's what I do, okay. You know.
And do you find music to be healing? What does it do for you?
Oh man, it heals. It is love. Music is a message. I believe that you just have to, it reaches all cultures, mm-hmm. You know, and I basically it's about the message you're saying in your music, okay. And I think it brings healing.
And how do you think it can help the kids out there? You know, a lot of them are struggling, and, you know, like we were talking about, mm-hmm. A lot of the outlets that we might have had before aren't funded. How can it help kids who need it?
Well, like I said, it's kids out there now with talent, mm-hmm. And where will they go to get groomed? Mm-hmm. But in school, you know, sometimes the parents are busy and, you know, don't have enough money to put in and invest. So I think raising money for that cause will also help the community and the kids in the community. I believe it's very important because it helped me. It helped me get to where I am right now.
So tell us, where is Jazzy Jam taking place? Where can they find more information about it?
Jazzy Jam is in Pasadena, right in the heart of Pasadena, Central Park, okay. 214 South Fair Oaks,
okay.
At 11 a.m.
When is it? This week?
May 26th.
May 26th.
Next week.
Okay. And what kind of artists are going to be there?
Oh, man. I'm not going to give you the whole lineup. I'm going to give you a little
Just
bit.
Give us a little bit of tease.
We have the professional, world-renowned Kurt Whalen is going to be there, and also myself.
Okay, well, there you
go.
There
you go.
They don't need any more information, right?
Yes.
But the other artists are out there on the website.
Yes.
They can find out more about them.
On the website, go to jazzyjam.com, and you can find out the lineup, and also you can purchase your tickets from there.
Okay, perfect. Well, thank you so much, Romaine, for coming out, and
Thanks
we
for
look forward to hearing more of your music out there.
Okay.
All right, well, that is it for this newscast. We will... of the special edition of Crown City News, thanks to Irma Strantz with the League of Women Voters, Claudine Robinson with the American Cancer Society, and Romaine Jones with Jazzy Jam Pasadena for going on camera with us. Thanks to all of our sponsors, including Southern California Edison, Wink Marketing, and the Pasadena Enterprise Center office building with available space. Thanks also to the CCN crew. They make this show possible. But finally, we thank you for watching CCN Crown City News. Join us each week as we cover the news in Pasadena and the San Gabriel Valley. For all of us here at CCN, I'm Sehnita Joshua Mattison. Have a great week.
Hi, I'm Jesse Avila at the Convalescent Aid Society, a nonprofit organization established in 1920.